Shifting of anti-salmeterol to fluticasone propinate in children with asthma.
Asthma is a condition that can affect all ages, but especially children. The airway can become blocked, causing a person to have difficulty breathing. Some common triggers of an asthma attack include changes in the weather, allergies,
Salmeterol to fluticasone propinate. Long-acting beta-agonists such as salmeterol have been readily associated with increased risk of asthma-related death. When used to treat asthma, salmeterol must be used along with another asthma control medicine. Benefits: salmeterol in combination with an inhalator corticosteroid, fluticasone propinate has safely perfect comparability to that monotherapy when used to treat in children and adolescents with asthma. I'll evaluate using a criterion of assessment composed of severe asthma-related events. Side effects: within cocaine or another breathing problems after using this medication, chest pain, facial odor, heartbeat, feeling relaxed, shaking, severe headaches, palpitations in your neck or your ears, bleeding from the nose, fever, chills, swollen glands, storing the mouth, storing the sick, flu symptoms, cone with yellow or green mucus, blurred vision, tunnel vision. Nursing care: do not use any other form of salmeterol on another bronchodilator in a similar inhalator. Avoid being around people who are sick or have infections. This condition can be severe and fatal in the people who are using steroid medicine. Fluticasone and salmeterol is the recourse medicine. This medication will not work without years to try an asthma attack or bronchospasm. Conclusion: in pediatric patients with the present asthma, fluticasone salmeterol propinated twice a day is usually be tolerated, with a safe profile similar of the fluticasone propinate alone. The combination allows short-term or third-line, but there is a risk that in the certain patients of their sick can become fatal. In the video,
Asthma is inflammation of the airways, or another way to think about it is the airways of the lungs are irritated. That inflammation or irritation causes the airways to swell. They produce mucus or phlegm. And there's like a skin on the inside of the airways that sheds off. There's also smooth muscles that wrap around the airways that tighten down. In the great majority of the people, there's a genetic component, and that makes the airways hyper-responsive to things that trigger it. And usually that includes some form of allergies, eczema, hay fever, that type of thing, because allergies can be one of the things that triggers it, but not everybody has allergies. Probably the most basic symptom is a recurrent cough. Many people think you have to have the asthma attack, but probably the majority of the people that I see don't have that. They just have a recurrent or persistent cough that occurs either with exercise, at nighttime, with colds, or something like that. But the recurrence and the persistence of it is the thing that might trigger you to think that asthma is going on. Other other symptoms, the classic thing is the wheezing, difficulty breathing, the asthma attacks or asthma flares that everybody thinks about. You can also get chest pain with asthma. The most common place where you feel that is in the upper chest, where you get kind of a tight feeling in the chest as those smooth muscles in the airways retract or constrict. Coughing up a lot of phlegm can also be a symptom of having asthma. Allergies are probably the most common trigger. 85% of people with asthma have some form of allergies. Being upset about something, being angry about something can trigger quick relief or bronchodilator medication. One of the things that can occur with asthma is the smooth muscles that wrap around the airway tighten down. So we have medication that relaxes those smooth muscles and opens up the smooth muscles. That medication works within 15 minutes of giving it. It works to its maximum effect every time. However, it doesn't do anything about the inflammation. So we say it's a good, quick relief medicine. If you're having symptoms or if you're going to exercise in the near future, you take that medication and it treats those symptoms. It doesn't prevent symptoms from occurring tomorrow or the day after that, however. For that, we use the preventative or controller medications, and those medications really get more at the root of the asthma and control that inflammation or suppress that inflammation. Those medicines typically take time to become more effective, can take up to 2 weeks. So if you wait till the symptoms are
in another video.
How to use an inhaler. Hi, Emily. Are you ready to show us how to use an inhaler?
Inhalers can come in all different shapes and sizes.
Now, how are you supposed to use it? Like this?
No!
Negative, Emily.
That's right, Emily. You can't just puff it in your mouth. The medicine will get stuck in your mouth and throat, and it needs to get all the way to your lungs. What do we need, Emily?
Perfect, Emily. You have a spacer. A spacer is a tool to make sure you get the right amount of medicine from your inhaler and that it goes to your lungs.
Spacers can also come in all different shapes and sizes.
Now, Emily is going to show us the right way to use an inhaler with a spacer. First, sit up and take the caps off your...
When you are ready to use it, shake the inhaler for 5 seconds and put it into the open end of the spacer.
Then, tilt your head back a little and breathe out as much as you can. Then, put the mouthpiece of the spacer in your mouth. Make sure you seal your lips around it tight.
Now press the inhaler to puff once and breathe in slowly and deeply for 3 to 5 seconds.
1, 2, 3, 4, 5.
Then hold your breath for 10 seconds, or as long as you can.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now, take the spacer from your mouth and blow out slowly. If you have trouble taking that one big deep breath, you can take 3 or 4 slow deep breaths instead. One more time.
Yahoo! You did it! Good job.